New York was the epicenter of the COVID-19 pandemic, but New Yorkers are tough. They fought back and were able to flatten the curve. Unfortunately, not before coronavirus had already ravaged communities of color. The data shows us that African Americans and Latinos are dying at a disproportionately higher rates compared to all other ethnicities. As the city safely reopens and gets back to business, marginalized low-income minority families are simply trying to survive this pandemic. Let's take a closer look at the coronavirus through a Black and brown lens.
I'm going to bring to you many healthcare professionals who are experts in their field, and they're going to talk about this virus and how it's impacting our communities and what we can do about it, and just putting a spotlight on it so we can bring our stories to the forefront, because I always feel like if we're not telling our stories, then we don't own our narrative. So stick with me. This is a 4-part series, the coronavirus through a Black and brown lens. Dr. Riley, I want to thank you for taking time out of your busy schedule to talk with me today about a very important subject. Coronavirus is ravaging our communities, and we want to talk about it.
Thank you for the invitation. Thank you.
SUNY Downstate is a COVID-19 hospital, right?
So yes, we have been treating exclusively for the last 2 months, just COVID-only patients.
Give me an idea of what that looks like. How many people have gone through your doors, your hospital doors, affected with the coronavirus?
Admitted got as high as 265 patients. And we had almost, of that 265, we had almost 65 patients on a ventilator at one time. And that is very high, because on any given non-COVID day, we might have only 5 or 6 patients on a ventilator. So we had 10 times the number of patients on a ventilator during COVID, during this COVID period than we would have normally.
Wow.
In terms of age, the youngest patient we've had is a 2-year-old boy who did fine. He went home. Our oldest has been 99. The average age is about 75.6. There's a little bit of a male predominance to the disease, so about 54% were male and the rest women. In terms of the deaths tended to be visited upon the elderly, those over 65 and above. Mm-hmm. 3 top multiple medical problems were, number 1, hypertension, number 2, diabetes, and number 3, obesity. Those are the 3 most common that we saw. Interestingly, we did not see a whole lot of patients with COVID who have asthma or COPD or HIV, which is really, we would have thought they would have been at higher risk, but it turns out our patient experience, which I think is consistent with other hospitals in the country, is that we've had very few patients with HIV with COVID, and we've had a surprisingly low number of patients with respiratory problems.
My heart bleeds for all of us. As Americans, we're all dealing with this, and it's unfathomable that this would be happening, but it is happening. And you have some communities who are getting hit harder. So the Black communities are getting hit much harder, and we're not prepared.
This whole pandemic has, if not laid bare, it's shined a very bright light on the high health disparities that exist in Black and brown communities in New York City and around the country. And again, this is one of the unfortunate aspects of this disease, is that it's just been really, really devastating to Black and brown communities. The things I think is going to have to happen, we're going to have a really, really focused effort on Black and brown health, not just Black and brown healthcare, but Black and brown health. What are the things that we know to do to get hypertension under control, to get diabetes under control, to get obesity under control? And there's going to really need to be a national focus on this.
Do you think the fact that a lot of Black and brown people are actually frontline workers? They're the ones driving the buses. They're the ones working in the grocery stores. They're the doctors, nurses. So that's playing a heavy role, I would think, in the numbers as well.
Yes, I think that is a contributing factor. To what degree, we won't really know until we look at the data. Months from now, when we look at everybody who got COVID and what type of occupation they had and where did they work and what type of transportation did they use. But we know that Black and brown communities do what my grandmother used to say, the work of the world. They drive the buses. They serve the public. They're in service industry jobs that require you to be at work. They tend not to be in jobs where, quote unquote, you can work remotely. So again, you're now throwing into this whole socioeconomics of Black and brown communities is a significant contributing factor to what has now resulted in a public and medical crises around COVID in Black and brown communities.
What do we need to do in the Black and brown communities to lessen this impact? I find that especially the younger people, they're not taking this serious. They're not wearing their masks. They are not social distancing. And what they don't understand is when you do that and you go home and you give it to your grandmother or you give it to your mother, they're not understanding that. So is there something that you can say that can possibly help them understand how this virus works?
And you just got to be blunt with them. Look, this virus it doesn't play, and even though you may be feeling well, and even though you're tired of being cooped up, if you go out and you don't wear a mask and you have it, and you go back home or you go to other areas where there's people who are elderly or a cousin who has diabetes it could result in them being very sick or their death.
We can't fight this virus in this manner. We won't win, and we're not winning.
Because we're really worried about a second wave of this thing coming back in the fall.
Heard that, and a lot of people are talking that up. So it makes me think that it's really going to happen, almost as if they know it's going to happen, and they're just slowly getting everybody on board to start thinking ahead that we're going to see this again.
Right. We're operating as if we're going to see it again. Because remember, if you looked at the flu epidemic of 1918, there was a second wave. Mm-hmm. The second wave was worse than the first wave with the Spanish flu epidemic of 1918.
Families that are losing their loved ones in a rate that is beyond anybody's comprehension. Who would have thought that you would have your mom and your dad and your uncles and different family members, and they're disappearing. They're going into the hospital and they're not coming out.
And to make sure they had the best health care, just as good a health care as somebody else on a better part of town. Listen to the health professionals. We spent our life, we've dedicated our life to make the best decisions and the best advice for our communities. And that's the spirit in which I approach my work, not only as a president of a health sciences university in Brooklyn, but as a physician.
Dr. Riley, well said. Thank you so much. And from the bottom of my heart, I am just so thankful that we have a place like Downstate, a great university, a great hospital that we can rely on in a time like this, because some of the hospitals aren't as good as Downstate. So
that's
to
right.
You and all the essential workers at Downstate, I say thank you.
Thank you so much, and I look forward to further conversations. Thank you.
Yes, I will call on you for some other pieces. Thank you so much.
Let it go.